Welcome back to the Aging with Options show. I'm Chris McCutcheon. I'm pleased to be joined with Lynn Harrelson with Senior Pharmacy Solutions. Lynn is a senior care pharmacist and provides much-needed counseling in the homes of seniors and others taking multiple medications. As we wrap up the final segment of the show, Lynn, one thing we haven't talked about, and certainly on the minds of anyone when you're talking about health care, is your services are certainly, we've seen the value of it and the need of it, the importance of it. Mm-hmm. The reality of the situation of multiple medications, but we haven't yet touched on the cost of your services. So give us a little insight as to how that works.
I work on a fee-for-service basis. That means that I bill my patients directly. My fees many times are reimbursable under long-term care, their health care insurance, or the Medicare D program. I can provide the documentation for that. The comprehensive review, the 2 visits, the 90-day coaching period is $400. What I have found is that in my reviews, on average, I'm able to either stop, change, or reduce, through my working with the patients, their families, caregivers, and physicians, 7 medications. That's 7 medications that are usually no longer in use. My patients have fewer emergency rooms, hospital visits, so they save a lot on the copay. I've had feedback from my patients that they actually consider my visit into their home and helping them with their medicine a moneymaker for them because it's a financial peace of mind because there's less going out. But the other thing, there's just peace of mind knowing that mom or dad or that the senior is actually just doing better, able to get around and do the activities of daily living, feel better, and be more engaged.
Right. So there's certainly a financial benefit potentially to the services that you're providing, but impossible, I would think, to put a price tag on the physical, emotional benefits to improving someone's health that may be suffering some of the consequences that we've talked about being on multiple medications.
We need to change our attitude about our health, and our health is an investment. Our health care is an investment. And my service is a good return on that investment. It can be a long-term investment.
Great. Tell us quickly, Lynn, here as we wrap up, if you can, about the apothecary jar in your office.
Okay. A long time ago, I started adding a tablet or capsule every time I stopped, changed, or reduced a medicine. I dropped a tablet or a capsule in the jar. It now holds over 10,000 or close to 10,000 tablets. That's 10,000 tablets or capsules no longer being in use or being used the same way as a result of my services.
Unbelievable. Fascinating. Good for you. A couple of points just to hit on here. Lynn, we've been talking about seniors specifically, but certainly your services are available to anyone taking multiple medications, not just seniors.
My youngest patient is 23.
Wow. And we've talked about taking your services being provided in the home, but of course home can be a number of places, maybe a skilled facility, an assisted living facility, independent living facility.
Actually, the skilled facilities already have contracted pharmacists. Okay. It is assisted living, retirement, and then the private homes.
Right. And tell our listeners, Lynn, how to get a hold of you.
I can be reached at my home office phone number. That is 425-8642. It has a 502 area code. And I can also be reached through L. Harrelson, K-Y, Lharrelson